Nonverbal communication is an integral part of how we communicate with and understand each other, and is particularly important in healthcare settings.
Patients and family members are highly sensitive to professionals' nonverbal communication. When we feel fear or uncertainty, we tend to become more alert and try to lessen this uncertainty by looking for information in our environment. This is a common experience for patients and families in healthcare settings.
At the same time, health professionals rely on the nonverbal communications from their patients. In order to gain a better understanding of our patients, we must recognize the importance of reading facial expressions, gestures, and body postures. We must also acknowledge how our own nonverbal communication may affect our patients.
Nonverbal communication is any communication without words. This includes body motions, facial expressions, and use of space, sounds, and touch. Nonverbal communications can be vocal or non-vocal, intentional or unintentional. Here, we'll talk about 5 dimensions of nonverbal communication: gestures, facial expressions, gaze, space, and touch.
Gestures can be very powerful tools and need to be used consciously and purposefully. For example, head nodding can convey a positive attitude and help encourage the other person to continue talking. On the other hand, too much nodding may make you look insecure.
Other gestures include body leaning. Forward typically conveys interest, while backward can show the opposite. Hand gestures, which may have a very specific or more ambiguous meaning, or even shuffling the papers on your desk to indicate that your meeting is drawing to a close.
It's estimated that 55% of nonverbal communication is facial. Facial expressions can convey insight into a person's reactions and inner feelings. Luckily, many facial expressions are universal, although the rules for guiding when and where a particular expression is shown are not the same across cultures.
Like other forms of communication, eye contact is an interaction. Too much can be uncomfortable, but too little can make the person feel that they're not being attended to. The goal is to strike a balance so that both parties feel comfortable, and you'll need to read other nonverbal cues to determine this medium.
It's also important to remember that eye contact interacts with many other variables beyond interest and comfort, such as gender and culture. For that reason, make sure you don't read too much into the presence or absence of eye contact from your patient.
Environmental conditions are an aspect of nonverbal communication that can have a profound impact on people in healthcare settings. Factors such as the formality of the environment, the perceived warmth, privacy, noise, and familiarity can influence the patient's comfort and color their communications with healthcare professionals.
When patients enter a healthcare environment, they're forced to give up some measure of control over their environment, their privacy, and their personal space. This can create feelings of anxiety. We can help ease this by showing the patient respect and helping them retain some control over their space. Ask before entering their room, and ask if they'd like their door to be open or closed when you leave.
Different cultures and different individuals within cultures have various comfort levels when it comes to physical distance during communication. These distance zones are chosen by the individual based on their feelings, what they're doing, the nature of the relationship, and the communication itself. Being sensitive to distance is important as healthcare professionals because it can create comfort and increase the effectiveness of communication with our patients. Whenever possible, allow the patient to establish the distance zone for your communication.
Touch is used by health professionals for a variety of purposes. It can be used as a diagnostic tool or as a way to comfort and reassure patients. However, touch can be interpreted by an individual in many different ways, and different people have different levels of comfort when it comes to being touched.
Here are some general guidelines for the use of touch. Use your judgment in determining whether touch is appropriate for this particular situation. Touch may impose more intimacy on the patient than they desire, so it's important to gauge the relationship and the degree of closeness that the gesture implies. Finally, ask yourself, what is the purpose of this communication? Is the touch for the patient or for you? If there's any doubt, then it should be avoided.
Nonverbal communication has 5 main purposes. The first is expression of feelings or emotions. A patient may furrow their brow to indicate confusion or disagreement, or may cry out when they're in pain.
The second is regulating the interaction. We use nonverbal communication to indicate whose turn it is to talk, by eye contact or a slight nod of the head. Or we can communicate that an interaction is drawing to a close by getting up from your chair.
The third is validating verbal communication. If I say, yes, absolutely, and nod my head up and down, my body language is in agreement with my verbal communication. However, if I were to say, yes, absolutely, but shake my head as if to say no, this would be difficult to interpret.
The fourth use of nonverbal communication is maintenance of self-image. The clothing we wear often reflects the person we perceive ourselves to be.
Finally, nonverbal communication is used in the maintenance of relationships. We communicate nonverbally about things like inclusion, status, control, or affection. For example, sitting next to your patient is more collaborative than standing over your patient. We use clothing to express social, economic, and professional status, or inclusion in a group. The clothing that we choose to wear as healthcare professionals can communicate power and authority to our patients. This may be helpful or may pose a barrier to communication and collaboration.
To communicate effectively, we need to take into account how we want to be perceived and the effect this has on communication. Remember that nonverbal cues don't necessarily have singular meanings and don't exist in isolation apart from other aspects of communication. The communication process is complex and multidimensional, so making sense of nonverbal cues requires taking into account the context of the entire situation.